Good morning, everyone, and welcome to today's Seniors Living Well. This year, this series, the fourth series that we've done, the theme is Make 2013 Your Lucky Year. And we're offering a whole slew of information about being proactive about making your life better. In our first series last week, we had a variety of guests. John Blassingame, Supervisor Blassingame, and talked about the RX card, which allows you to get your medications at a very reasonable price. In many cases, people can get medications that they couldn't otherwise afford. We had Tom Thompson coming from the food bank to talk about volunteer opportunities, and also the transition he made from being the Raley's manager to the food bank manager. And we had Annie Boyce, lively Annie Boyce, talking about the Miss Senior Beauty Pageant. Today we have kind of a lot of health-related things. And joining me as my first guest is one of our longtime physicians in the county, Dr. Kevin Blassingame. Welcome, Dr. Blassingame.
Thanks for
coming
having me.
in. How long have you been here in Amador County?
It will be 9 years in June.
Wow, almost coming up on a decade, huh?
Mm-hmm.
And your office is on New York Ranch Road?
Yes, in the business complex there.
In the business complex there. And you are a general practitioner?
I'm a internal medicine specialist.
Internal medicine.
I'm board certified by the American Board of Internal Medicine.
Mm-hmm. And big question, are you taking new patients?
I am taking new patients,
That's wonderful, including Medicare.
especially Medicare.
Okay, everybody, it can no longer be said there are no doctors in the county taking new patients. So you say especially Medicare, which is really important. At the Senior Center, we, of course, know that a lot of folks are turning 65 and coming on Medicare. It's kept the high cap people busy.
Mm-hmm.
So when you have a patient who suddenly goes on Medicare, or you get a new person moving up here to the county to retire who's on Medicare, what kinds of things do you suggest that they do?
Well, when you first go to the doctor, when you've just come onto Medicare, Medicare has provided a service called Welcome to Medicare, and it's a free kind of comprehensive assessment of your health. I do that anyway, but they're particularly wanting people's health maintenance to be maintained and any issues with regards to screening for serious health threats to be done. In particular, the most common cancer in men is prostate cancer,
Mm-hmm.
so they want, a PSA test to be done, blood test. And for women, the most common cancer is breast cancer, so they want them to make sure they get their mammogram. Medicare pays for a mammogram every year.
Mm-hmm.
If there is an abnormality, of course, they pay for an unlimited number of studies to assess that.
So if a woman had an abnormal mammogram, they could get like a sonogram, or I don't
Yes.
even remember what the next.
Well, sometimes they will get, a needle biopsy if there's a mass or an abnormality on the mammogram study.
And that's covered under the Welcome to Medicare.
Well, it's covered under Medicare in general.
In general.
But the Welcome to Medicare is just a healthy assessment, a not sick visit.
Uh-huh.
But as I said, every patient, every visit, I look at all of their health maintenance and make sure everything's up to date.
Mm-hmm.
And if it's not, I try and encourage them to get things done.
Mm-hmm.
Some things like colonoscopy, which Medicare will pay for every 10 years.
Mm-hmm.
And actually, they'll pay for it more often than that if there's an abnormality.
Mm-hmm.
But those kind of things sometimes people don't want to have done.
Mm-hmm. So Medicare encourages, as part of this Welcome to Medicare healthy screening, that you have a colonoscopy, the appropriate mammogram or PSA screening. What about, since heart disease is such a serious, do they pay for an EKG, a chest x-ray?
Well, heart disease has been the leading cause of death. But now they've done such a good job with heart disease that cancer death is starting to be the highest cause of death.
Mm-hmm.
The kind of screening for heart disease is kind of nebulous because there's not really any guidelines for that.
Mm-hmm.
So I look at the major risk factors that a person has, and if they have several risk factors, one of them being just age.
Mm-hmm.
Then I will refer them to the local cardiologist here for a full stress test and assessment of their heart health.
Uh-huh. And now with women, of course, we see a lot of osteoporosis. So what does it, is there like a, I forget the name of the test that they do at the hospital.
It's called DEXA scan.
DEXA scan. Uh-huh.
For women, they want you to get a DEXA scan when you're 65, and then every 2 years thereafter.
Every 2 years, no matter the result, or
Yeah, no matter the result.
wow,
They'll pay every 2 years for that because, broken hips are a very expensive proposition. And
Yes.
so it's much cheaper to find things early and try and head them off before it
Absolutely.
happens.
Great. What about things like vaccinations? I mean, I got shingles right after I turned 60, so the minute I could, I got the shingles vaccine, which Medicare now pays for, I believe.
I don't think they do pay for that.
Oh, really? Okay.
Yeah, it's a very, very expensive vaccine. It's on the order of $200.
Yep.
And most insurances don't pay for it either. But they do recommend it for everyone 60 and older. Medicare does pay for a pneumonia vaccine, which they recommend at age 65. And then, of course, they want everyone to have a flu vaccine every year, regardless of age now.
Right. We're
know.
doing everybody in the county.
Well, they found that, flu is being spread by children, and so now they want children to get vaccinated as well.
Do you see children in your practice, or is it all just adults?
Adults only. Internal medicine, it would probably be better to be called adultiatrics or something like that.
Adultiatrics. Not quite geriatrics, but adultiatrics.
Yeah, most of my patients are geriatric Medicare patients that have many different serious medical problems. And that's what internists do, as opposed to pediatricians, which take care of complex problems in children.
In children, right.
And so, family practitioners kind of do a little of both. But, in the spectrum of medicines, internal medicine is kind of where all the other subspecialists come from, like your heart specialist and your kidney specialist and your lung specialist. They're all internists as well.
As well as they go off and do a
Yeah, they do
specialty.
additional
Yeah.
training after they finish their general internal medicine training.
So you probably find that you're becoming sort of a de facto geriatrician, just because, would you say a bulk of your patients are 65 and older?
I would
or
say the
60 and
majority
older?
of the adults in the county are probably
30%,
over 65.
33%. Yeah, it's true. It's true.
But I find that older individuals are much easier to work with and much more compliant with my suggestions, and it works very well, to maintain their health. They're very aggressive about wanting to get their health taken care of. And they start thinking, once you retire, you have nothing better to think about but your own health, right?
Well,
But, people start thinking about exercise programs and their walks every day, and we encourage them to do that.
and smoking cessation?
Smoking's always a big problem, and Medicare has special programs for smoking cessation that they don't charge the patient at all to receive
Really?
the counseling. Also for obesity counseling as well.
Aha.
And so they have a big push on the obesity counseling right now.
And a little later in the program, we're going to have Maureen from the Sutter Amateur Outpatient Diabetic Program, which is a nationally recognized program. So I assume that when you have patients who are pre-diabetic or as we used to call it, borderline diabetic, you encourage them to enroll in that program, because I know Medicare does pay for that screening.
Yes, and they do an excellent job there, and patients get a lot out of it and do a lot of behavior modification and learn the foods that are more costly to eat in terms of raising your blood sugars and raising your weight.
Yeah, I'm a graduate of that program, actually. I brought my A1C down from it was in the high 8s down to under 6, so they really helped me a lot. It was great. We've talked about smoking, we've talked about eating and exercise. There's a lot of talk about mental health issues in older people now. Are you seeing a lot of depression in your older patients, or any, or?
I do see a lot of trouble sleeping and a lot of trouble with depression. A lot of people don't have the financial resources that they had hoped they would have when they're retired.
Oh, yeah.
And so, financially they have problems. And, of course, as you age, you have trouble maintaining your home. I have to always consider safety issues. One of the responsibilities that doctors have is we have to report to Adult Protective Services if there's a dangerous situation at home. Fortunately, I've rarely had to use that, but we have that facility available, with the county here.
So that's wonderful to know. For families out there, if you see, say, an 80 or 85-year-old person who comes into your office and is starting to appear like they're declining, and maybe they have mental issues or maybe they don't, but you feel like maybe they're at risk, you have the conversation with them, I assume. But you don't hesitate to call APS if you think it's a dangerous situation.
If it's necessary, we try and work with their family,
Mm-hmm.
especially as they become more debilitated. We try and have them bring their
Mm-hmm.
family members with them. Usually they'll have a daughter or a son who will be looking after them. But there's situations where they don't have any relatives, and that's difficult to deal with.
Yeah. Well, they can. The families can always call the senior center too. We do a lot.
We send them there.
Yeah. That we have had people say, my doctor, told me to call you. So if someone wanted to get into your practice, how would they reach you?
They can call us at 223-4700.
That's 223-4700. That is an easy one to remember.
Yeah, we're not too far from the senior center.
Right, just down the road from us on New York Ranch Road.
We encourage people to go and eat lunch there and have some social interaction with other people.
Oh, wonderful, wonderful. That counteracts depression, doesn't it?
It does, social isolation.
Yeah. Well, I really appreciate you coming on the show. If there was one thing that you wish your patients would do, is there like one particular lifestyle thing that...
I would say keep up some sort of exercise program.
Keep up some sort of exercise.
Daily walking.
Great. And we are going to be talking about exercise a little bit later. So again, Dr. Blassingame, thank you so much for coming in. And that was a nice comprehensive coverage. Nobody should worry about going in for their welcome to Medicare. And I assume they can turn those screenings down if they are a little non-compliant.
Well, some things cost more than others, and you have to think about people's budgets.
Okay. Well, that's great. Thank you so much.
Thank you.
Stay tuned. Coming back, we'll be talking to Maureen from the diabetic program.
Amador Senior Center, making life safe, comfortable, and interesting for our Foothills seniors.